Hi, I'm Dr. David Novanek of Doctor's Choice Physical Medicine Rehab in Pottsville, Pennsylvania. And today we're going to go over a test that we do at the office. And really, it's the underlying problem of most musculoskeletal complaints, especially a chronic one, or for sports injuries, a sports one. Now, what we're going to review is a screening by the National Academy of Sports Medicine for musculoskeletal problems, primarily with the back and shoulders. So I'm going to run this through with a patient, Danielle, so we'll see what type of problem she has, and to see if the problem's in her muscles or in her joints. So if you could stand right here, Danielle, and put your feet about shoulder width apart, okay, and feet straight ahead. Feet straight ahead. Okay, arms up over your head. Okay, get them up straight, reach for the ceiling. Now, I'd like you to squat, keep your heels on the ground. That's as far as you can go. Okay? Can you do that again for us, please? Okay. So you can see when she's doing this that her feet want to go out, especially that left one, and that her knees are coming together when she does that. Now, it could be a problem in her joints or a muscle imbalance in her system. But I'm asking her to go down as far as she can, and that's as far as she can go. Now, let's take a look at it from the side. Can you stand and face that way? And get in the same position. Shoulder width apart, feet straight ahead. Bring this toe in a little bit more. Reach for the sky and go ahead down. So you can see that she's locking up, keep going down, and that her arms are starting to fall forward. This part of her body and this part of her body should form the same type of angle when she's bent over, when she's squatting. Okay, I'm going to have you come back here, face the camera again, and we're going to have her stand up on some wedges and see if that makes a change or not. Okay? Shoulder width apart, feet straight ahead, arms up. Okay, and squat. There's a big difference there. Okay? Now her knees are still going in, but you can see she can get down a lot further. I'm going to move the wedges here, and we'll look at her from the side again. You can face that way and do it for us. Arms up over your head, and squat. Okay? Much better. Okay, her arms are staying up higher, and you can see she's getting down lower. So that tells us that she has problems. She has a muscle imbalance in her system. Now, what you see here is pretty common. She's a little bit more severe than we normally see, but she's squatting down and she can't get down. So what do people do then when they can't get down? They fall forward. And that's how they start hurting their back. Their back comes apart because their hips and their knees can't move. We're going to do this one more time, and we're going to put orthotics underneath her arches because she seems to have a problem with her foot rotating in, or people might call it a flat foot. So let's turn her again this way, and let's have you stand on the orthotics.
That's not good.
You okay? Mm-hmm. Arms up over your head. Okay, let's try squatting again. Okay, try going lower. Low as you can go. Keep those heels down. That's a huge difference. Okay? So to me, her knees still went in a little bit, but she's starting to function a lot better. And let's see it from the side again and see what it looks like.
Oh no, that's horrible. Oh.
Okay, arms up over your head, and go ahead, squat. Okay.
Oh.
Try going lower.
Birthday present, right?
You can see this is still, she's staying pretty well arched in here. Sometimes you'll see that the butt will actually roll down as people try to compensate and lean forward, but she's keeping this pretty well locked. But when you have problems like this, you can get therapy and everything else, or medication, or manipulation, or chiropractic, whatever, but you're not going to really change anything on a permanent basis until you change how the body works. And sometimes you got to go right down to the feet to solve the problem. So if you think you have problems like this, or like a screening like this, for you to see how you can squat and what type of problems you may have, you can give us a call at 570-622-2525, and just ask for a squat screening. Would be happy to do this. And again, I'm Dr. David Novanak of Doctor's Choice Physical Medicine Rehab in Pottsville, Pennsylvania.